There are parts of this country where people have to travel for over an hour to deliver their babies. Do we know what happens in those situations? Because maternity wards are closing. That's when babies die. That's when moms die. This is serious. This is not, you know, do I have enough money to get an extra doll? This is our people going to live.
Hello, everyone, and welcome to the Jessica Yellin Show, where every week we work to connect the dots on what's happening politics, culture, and the world in ways that leave you informed, empowered, and ideally calm. But that's always more an ambition than a reality these days. Today, we are talking about the big, beautiful bill and what's behind those headlines about cuts to Medicare and Medicaid. What might these changes mean for people in your world and for your own medical care as well? I'm really thrilled to be joined today by Chiquita Brooks-Lasure. Few people know this program better than she does. She is the former administrator for the Centers for Medicare and Medicaid Services in the Biden administration. She oversaw programs that included Medicare, Medicaid, the Children's Health Insurance Program, and the Affordable Care Act's health insurance marketplaces. Chiquita, thank you so much for being here today.
Thank you for having me.
You are in hot demand. Your body of knowledge is very valuable right now. You led the nation's largest public health insurance programs. And when you look at this bill, just before we get into the details, I want a very big picture analysis. What, in your view, are the most serious consequences for American society? Can you hear me?
Yes, thank you.
Okay.
So, just to say, this bill has huge implications for so many people. There are over $1 trillion in cuts to Medicaid and the Affordable Care Act. And I just want to tell you just a little bit about what this program means. There are 100 million people in our country who are on Medicaid and marketplace country coverage in this country. We've really hit a great place in lowering our uninsured. And we need to have everyone in this country able to live their best lives. And that starts by being able to go to the doctor when you're sick. It starts when you're born, the mom being able to deliver her baby. Do you know that almost 50% of the births in this country are through the Medicaid program? So Medicaid has become this lifeline for our country in terms of making sure that children get started in the right places. So many children, when they are born, who have issues like need to be in the NICU, need organs, for example, are covered by the Medicaid program. And so this legislation, it would change the way so many people get their healthcare coverage. They've added additional barriers that each individual one may not sound like the end of the world, but taken together, there are estimates that about 15 million people are going to lose their Medicaid or Affordable Care Act coverage, which not only would have implications for the people covered by these programs, but also for our entire healthcare system.
Let's get into some of those. And I thought it might be helpful if you could just give us one example. You talked about kids and people with disabilities, and that's who this program really serves. But can you take us into the life of one family? What might happen to one family if they lose their Medicaid?
So, I have had the privilege to talk to so many people across this country. One person that I spoke to when I was CMS administrator actually cried when she talked about what Medicaid meant to her, what Medicaid coverage. She was a woman in her 40s that had just been diagnosed with cancer. She didn't have any kids. And so, being covered by Medicaid, she just got covered because the state had expanded, and it meant that she was now getting her treatment for her cancer, her new cancer diagnosis. I talked to another family in North Carolina. a couple. The husband was a movie producer, but they had difficulty affording coverage. They were absolutely solidly middle class. They are on Affordable Care Act coverage, and thanks to things that we had done, they were able to afford coverage. He could employ people. They both ended up having serious cancer treatments during their time. But it's not just cancer, right? It's all sorts of things. It's families who really need to make sure their kids can go see the doctor. And as again, healthcare is so personal. There are so many of us who have kids that we're taking care of. I have an 11-year-old, and who are worried about our aging parents. And many people in this country need Medicaid to help them, either because their parents have to be in nursing homes or because they need a home health aide or assistance. And that's what Medicaid does for millions of people across this country.
One of the things that I've noticed in reporting on this story is many people who benefit from Medicaid don't even know that they're benefiting. You pointed out that it provides some of the subsidies that make healthcare affordable through the marketplaces from the Affordable Care Act. So you might just have traditional health insurance, but you're getting a subsidy or you're getting some support that would be cut by this. Also, though, Medicaid isn't, it's called different things in different states, right? Like it might not be the insurance I have.
That's absolutely right. So, states across the nation have given wonderful names to their Medicaid programs, things like Medi-Cal, Badger Care, all across the nation. Peach Care is to cover kids. I mean, they're different names. Or you can have private insurance, a company name that sounds the same as anybody who's employer-sponsored insurance. Back in the day, there used to be these signs, get your government hands off my Medicare. And that's the same thing that we have today, where so many people don't know that Medicaid is how they're getting coverage.
So let's take a step back for a minute. Republicans say that they're not cutting Medicaid. They say they're just adding work requirements. So on the surface, that does sound reasonable to some people. Would you
Hmm.
explain what we're missing in that political spin? How do these work requirements actually function? How do they lead to people losing coverage? And shouldn't some work requirements exist for people who can work?
You are right that it sounds very reasonable to say that people should be working if they can. But what we have seen time and time again is that when you add red tape, it holds everybody back. And I'll give you a few examples. So, Arkansas implemented work requirements, and they tried to do it very thoughtfully. But what they ended up finding out was that 95% of people met all of the requirements. They either were working, they were in school, they were taking care of someone, they were a child, but they lost 30% of enrollees. And that's because when you add these hoops, when you make people prove things, it often takes it often hurts everybody. And what we saw was, I'll give you an example of talking to a woman whose brother had a developmental disability, so absolutely was going to be exempted, but she was overwhelmed with filling out the paperwork to prove that he met the exemption. We've seen cases where people are working, but they miss a shift. And so having to estimate your time, it can seem easy if you have a job where you know you're going to make X thousand dollars a year to estimate your income. But if you are a waitress, if you're a gig worker where you have a couple of jobs, you lose a shift, all of a sudden you're no longer meeting your requirements. Then you go to the pharmacy says, your card's not working, right? Then you can't go, you have to miss a shift to go figure out what's going on. This is what happens to so many people. Another state tried to do work requirements. They spent $87 million trying to implement it and barely covered 5% of the people who were eligible. And they've taken a step back because, again, if you don't implement these things well, and we've all felt it, right? Have you ever argued with an insurance company or your provider about your whether something was covered?
Yes.
That's what this bill does. It adds so much red tape to the lives of
Oh.
people.
So so you're saying that 95% of those people in Arkansas were eligible, but they lost 30% of the people who were eligible because of all the bureaucratic hoops. It's just like creating even more red tape to get through to get your care.
Absolutely. And especially for people with disabilities, you find you often have to keep proving that you meet the level of disability. And that's why it can be so difficult. But there are other things in the bill, too, that we can go through in terms of making it more difficult for people.
One of them is the impact on Medicare. I think we should spend a moment on that. So, we've all talked a lot about Medicaid, but there's a requirement in the law that if a bill adds too much to our debt, it
Hmm.
automatically triggers cuts. And my understanding is the Nonpartisan Congressional Budget Office says that this bill would increase the deficit so much it could trigger more than $500 billion in automatic Medicare cuts under a rule nobody it's called pay-go. So I'm curious, do we know who would be impacted by those cuts if they happened? And what might be the real world consequence for seniors and providers if we saw this?
Medicare is a lifeline to our entire healthcare system. People who are over 65 or who have disabilities are covered by this program. It's over 60 million people. And when you talk about that level of cuts, $500 billion, that means there are only a couple of ways you can cut that. That's cutting payments to the doctors and other providers who offer care to people or cutting benefits. And that again, we want its core that doctors get paid when they see people. We have to make sure that we have a strong healthcare system where people get paid, and so that when you, as a senior, as a person who needs services, that you can actually go see the doctor.
And would you explain this? Because I know it's true, but I think do a better job explaining it. When Medicare or Medicaid is cut, there are some doctors that go out of business for even their non Medicare, Medicaid patients.
That's right, because you think about how important these programs are to keeping your doors open. Hospitals across this country are absolutely dependent on Medicare and Medicaid, and they are concerned about these cuts because if even if you have employer sponsored insurance, if the hospital can't stay open to take care of you, you won't be able to go. Doctors, most of the people in this country who go to the doctor are on the Medicare program, right? They need, because just think about who uses care in our country, the people who are older and people who have disabilities. And that's why it's so important, not just for the people who are covered by these programs, but for our whole healthcare system.
You had said that there are other limitations in this bill that make it harder to access Medicaid. Would you share one or two with us?
Sure. So we talked about work requirements. They also have added eligibility to do it more frequently. And again, this is more and more paperwork. They added a change to make it more difficult for people who are seniors to qualify for home and community-based services. So they've added new requirements. So on how much your house is worth, which
Wait,
means they'll
explain.
yes. So there's a new requirement in the law that would say if your house is worth, if you have more home equity in your house, more than $1 million. Do you know how much home equity you have in your house right now? So now you're going to have to fill that out when you're applying for Medicaid as well. So that's another change that's been added. That again, like every individual thing, you as a person might say that's a reasonable policy, but you add all of these things up and you ask people who are sick and struggling to fill out all of this information to prove it and approve it more frequently. And then we in the Biden administration saw a lot of inefficiencies in the way the programs were operating, and we put new requirements in to make it easier for people to get through the process, particularly for seniors. And they also are proposing to eliminate those rules.
It's interesting because I was going to ask. So, first, this reminds me, I often complain with health insurance that they just deny things hoping you won't appeal it. And they're just adding this paperwork roadblocks, hoping you give up and pay out of pocket.
Yes.
And it feels like that's what you're describing here, is that the government's basically trying to, how can we make it harder for you to collect?
That is feels exactly right.
Okay.
That just so many changes that are gonna make it like, is this even worth it to me? Would I wanna, put this kind of risk? Because we talked about Medicaid, now there's changes to the Affordable Care Act,
Okay.
similar roadblocks of saying, okay, it used to be we did a lot of things to make it automatic. Like if you're enrolled, you're automatically going to stay in coverage unless you make a change. That's how, if you have auto insurance, they automatically enroll you. And then if you want to make a change, you can. So they're taking away that provision.
So it wouldn't roll over. You would have to proactively reinsure or risk losing your insurance if you don't do it.
That's right. So that's just one change. Another change is they're making it more difficult for you to just get enrolled if you have a life change. So right now, it's it used to be that you could estimate your income pretty easily and find out when you go to healthcare.gov, whether you qualified for subsidies. They're now putting more requirements that you prove a whole list of things before you get that money. And again, this sort of speaks to your point about it almost makes it feel like, is it worth it to you? Do you feel like going through the process of proving all of this information to get the healthcare that you need?
Well, for some people, they don't have a choice. It's just,
Right.
which is part of what I find so confounding. Like, if all these people are voting for something, that means people in their states will not be able to get their cancer care, will not be able to pay for childbirth, and hospitals will shut down, and doctors will go out of business. Like, what do they think is going to happen? Like,
I cannot answer that
I,
question, but I can answer that I think it is clear that people do not truly understand the implications of these changes and how serious they can be and how devastating they can be for so many families in this country. So many of us, we don't even know how much these programs are helping us or our neighbors. And, often people don't find out that they need Medicaid until they're in a very difficult situation. Like, they find out, mom, dad has a really bad fall and needs care for a while. And they find out, oh, I actually need the Medicaid program to help me afford to take care of mom and dad.
right. You don't realize how quickly life changes, and you go from somebody where that's their problem to suddenly it's mine. Yeah.
Right.
Uh, I want to not spend a ton of time on this, but we should acknowledge that the argument for some of this is that the GOP says that they're rooting out waste, fraud, and abuse in the system. And for sure, the system has waste, fraud, and abuse in it. As you said, the Biden administration also worked on this.
Mhm.
What's a reform you would support?
Well, I would say, really making sure we go after providers or managed care plans that make sure they're actually providing the services is really crucial and core. And we certainly did that during the Biden administration, and states are working on that, but they could absolutely be beefing up those types of things. I'll give you one example. We have across this country a lot of agencies that jump up and harass people over the phone, pretend that they're offering services, and then they start billing Medicare or Medicaid. Yes, we spent a whole lot of time cracking down on fraud like that. That's where most of the fraud is in the Medicaid program. People billing who aren't actually providing services.
So it's scams. What you're saying
Yes,
is most of the money lost to fraud is from scam artists billing Medicaid for services not provided,
that's
not
right.
from individuals falsely claiming they have health needs when they're not qualified.
That's
Okay.
right.
Um, you know, I'm wondering, like broadly speaking, if since this bill will pull back on Medicaid, and some states, like where I live in California, they're saying like we'll find ways to try to fill in the gaps. Are we going to see a growing divide between healthcare available in red states and blue states?
I think that's a real possibility because so many blue states will feel obligated and be willing to step up. Although I would say that even some of the states like California, they are very dependent on federal dollars and probably would have to make some really tough choices if this bill were to become law. But I certainly think we already have a divide. I spent so much time in my time talking to rural hospitals across this country, and in red states who have not expanded Medicaid, they are struggling way more. There are so many hospital closures that are happening all over this country, especially in rural areas. And I really worry that our hospitals are more on the edge than people understand. The COVID-19 pandemic put a lot of them in basically, they survived because of federal payments. And so they're on the edge. And if we cut benefits right now, I really worried that we will see hospital closures across this country.
I'm just going to explain this for people who don't already know this, but please correct me if I say anything wrong. So, for folks who don't know, part of what Medicaid does is it gives money to states to fund both things like Medi-Cal, which is a health insurance program in my state, but also to help hospitals stay open.
Mhm.
And so, part of what this will do is cut the money that goes to the states, which will have a ripple effect through the state.
That's exactly right. So some of the cuts are specific to people being enrolled, which will have a effect on hospitals. But there also are changes that affect how much states are able to get from the federal government. And that at the end of the day will mean that states will be either have to come up with the money themselves or they'll have to cut payments to hospitals and other providers.
And can I ask you, since I've never been able to ask somebody who ran CMS before, when block grants are given to the states for Medicaid, and they actually like sign money over to hospitals, or they pay the hospitals through health insurance programs of the patients who go to the hospital?
There are a couple of ways, but mostly it's the state who is paying the hospital.
Right.
So it's not directly. So the federal government only gives money to states in Medicaid. We don't give money to, or I'm no longer in the federal government. The federal government doesn't give money directly to providers. So the states are setting the standards. They're figuring out, how do I pay my hospital providers? And some states give certain payments to hospitals for additional services, things along those lines. And then and then people are paid. So you as a Medicare beneficiary or Medicaid enrollee, the health plan is paying the
Right.
provider.
I'm going to ask one more wonky question, then we'll get back
Yeah.
to the general interest questions. Does Medicare work through the states in the same way?
No. So Medicare is federal. And
That's what I thought.
so CMS pays some doctors and hospitals directly, so they get paid. And then CMS also pays Medicare Advantage plans, and then the plans pay
Support, right.
directly.
So you mentioned COVID, and I wanted to ask because you ran CMS, I think, during part of the COVID
Mhm.
pandemic, and I'm curious what that crisis taught you about the role of Medicaid in American life, especially during moments of extreme vulnerability. And are you worried about these cuts coinciding with the rise of perhaps bird flu, measles, or another public health epidemic?
Absolutely. I will tell you, when I think all of us, when we thought of COVID, you would think of NIH, CDC, FDA. I was in so many discussions about COVID and addressing it because when people actually wanted to figure out, how do we get vaccines to people? How do we get treatment to people? They came looking to us. And Medicaid provided so much support in this country. It propped up the states so that they could they could fund their programs, nursing homes, when we were trying to figure out, how do we make sure that people are safe. It was the Medicaid program and the Medicare program who were so involved in trying to figure out these things. And every time we would try to figure out, how do we get things to the uninsured, guess where people would look? Like, why don't we figure out the Medicaid program? Because that's how, when you have an emergency, you realize, oh, we need to have everyone in this country have access to healthcare, so that and I know you know this, but It's so funny how quickly we forget. So what happened during COVID, right? Hospitals were they were filled. And so even if you didn't have COVID, you were affected. When you needed your surgery, the hospitals couldn't deal with you because they were dealing with COVID. That is one of the reasons why we needed to address the pandemic, because hospitals were overwhelmed. And then people who had surgery for heart conditions couldn't get their treatment. And it's just a reflection of we are all linked in our healthcare system. And so by not caring about whether people are insured, at the end of the day, we hurt ourselves in an emergency.
Uh, I don't want to go without acknowledging that so many people who care for parents and have parents in nursing homes often rely heavily on Medicaid to support that care. Um, I'm curious for folks who might be in this position. We have a lot of people in the audience who care for young kids and for their parents. What unintended challenges could this bill create for families who are trying to keep their loved ones who are in nursing homes safe and cared for?
I think that until you're in this situation, so many people don't know that Medicare only covers for a certain number of days in a nursing home. And so it is Medicaid that pays for nursing home care for a lot of middle class families. And it's also one of the main ways that people who have older family members get care in their homes, so home and community based services. So Medicaid is the primary support of a lot of these services. And again, it's lower income people, but it is increasingly middle class families who really expect that Medicare is going to pay for these things and aren't used to dealing with the Medicaid program. Again, like those of us in the sandwich generation, as we struggle with thinking about we're happy our older relatives are living a lot longer. They have a lot of demands. They don't want to live in nursing homes, right? They want to live in the baby boomers. They have a lot of thoughts.
Yeah, that's what they used to say about us. So now we get to say it about them. Yeah.
Exactly.
um, I'm so happy to talk to you because so often these conversations are with people who are political analysts, spin meisters, politicians. You actually do the work. Like you are the person who had to sit and go through some of these hard problems every day. And I wonder if you can step back for a minute and just reflect as a human being when you hear that this many millions of people could literally lose their health insurance, so many of whom don't even know this decision is about to be made. Like, what goes through your mind? How do you feel? What do you want people to know?
I want people to know how many people I've spoken to over the last 4 years, how much having health insurance changed their lives. So many people have broken down in tears talking to me. I was met with a group of people when I was in Oklahoma on the day of Medicaid expansion, and it was a room full of people who had worked for 10 years to get coverage in their state. And it was a group of hospital executives, advocates. I spoke to one woman who, when she got on the Affordable Care Act coverage, her premiums were about $70. Uh, after the subsidies, they were her premiums were $70 less a
Wow.
month, and her diabetes medication that she had just gotten diagnosed with diabetes was $50. So now she could pay
Yeah.
to get her diabetes treatment. I mean, these are the people that we're talking about, making their lives more difficult. And I mean, it really does break break my heart to think we are not realizing the toll on just people when they are there are people who do understand this law, and they are really afraid. They're really scared. I spoke to a man last week who had multiple sclerosis, and just even the struggle for him to be on the camera with us was heartbreaking. And just he was just talking about how difficult it was for him to even imagine having a work requirement and having to prove that. And it's it again, just heartbreaking that people's lives are going to be changing like this. And I really worry about our institutions, our hospitals. And, there are parts of this country where people have to travel for over an hour to deliver their babies. Do we know what happens in those situations? Because maternity wards are closing. That's when babies die. That's when moms die. This is serious. This is not, you know, do I have enough money to get an extra doll? This is, are people going to live?
Mm. Finally, I mean, this is such heavy stuff. I wonder, a lot of people say, okay, but what can I do about it? You're telling me all this scary stuff is going to happen. What can I do? If folks want to call their member or want to talk and speak and advocate, what's the message you would encourage them to deliver? What would you tell them they can do?
I would really urge people to make sure they are talking to their member of Congress and to say, you have to recognize how much these cuts will change and hurt people in your state, in our lives. And I think there's just so much misinformation and lies about what is occurring, and really making it clear this will affect people's lives, the people you say you care about: children, moms, people with disabilities. That's the message.
Okay. Chiquita Brooks-Lasure, thank you so much, both for your time today and for your service. Really
Thank you.
appreciate it. I'm grateful. I hope we can stay in touch and you let us know where we can find you and follow up on your work.
Absolutely. Thank you so much
Okay.
for having me.
Thanks so much.